violenceagainstwomen.net, an online resource library on gender-based violence, gives a wonderful list, a clear list that we can learn from on their website. So traffickers take advantage of push and pull factors to target victims. The push factors: war, violence, genocide, persecution, lack or limited employment and educational opportunities, as we earlier spoke about, and disasters, both natural and man-made. So let us really highlight this. We are in a disaster mode, so traffickers will take advantage of vulnerable people. Now, the pull factors. What pulls our victims? What pulls them? What pulls our targets to these traffickers? They are looking for safety and security. They are seeking freedom from persecution. They are looking for that availability of employment and education opportunities. And they are seeking, I don't know. Okay. They are seeking improved quality of life. And these are research studies, and the links are here if you would like to read the research studies and scholarly papers from Chang, Dabby, and Liwell. So the VAWNet is a project of the National Resource Center on Domestic Violence. The center recognizes that there are different philosophies, approaches, and debates surrounding human trafficking. One would think there is no debate, but on any controversial issue, on any social issue, there are always debates. So readers are encouraged to examine resources with a critical eye and an appreciation of the depth and breadth of the issues and perspectives on human trafficking. So we invite you to go to the vaw.net.org website for their expansive resources. The Human Trafficking Institute in Fairfax, Virginia is also a wealth of knowledge, and that's at traffickinginstitute.org. An estimated 24.9 million people are trafficked into forced labor or prostitution. Trafficking explodes in countries where the laws are not enforced. Annual trafficking profits exceed profits of major global corporations combined. So when we look at the large corporations that we know are bringing in high profits, annual trafficking causes a shadow on them. That's how much money is involved in trafficking and is gained by these criminal traffickers. Trafficking collapses when traffickers go to jail, but police and prosecutors worldwide are not often equipped to do so. The International Human Trafficking Institute in Atlanta, Georgia, has wonderful, informative, free webinars for our listening and viewing audience to take advantage of. Please do visit their website at ihinstitute.org. Among their resources, IHTI has tips for parents to talk to their children. So this is just a sampling of their website, what parents can do. Talk to your children, maintain an open line of communication. If they do something irresponsible, don't excommunicate them. They won't share with you. So parents have to learn tricks on how to keep open communication with their children, because if they don't have that open relationship with their children, those children may fall prey to trafficking. So although we mean well by disciplining our children, and we should teach them right from wrong, we have to be very careful about making sure they feel comfortable to come to their parents on any issues. And be careful when allowing your children to go alone to shopping centers and other. That's when traffickers choose their victims, when they're alone. Sorry. Now, we have to engage men in preventing violence against women and in preventing trafficking. The Justice Department in 2011 of the United States awarded $6.9 million in grants to engage men in preventing crimes against women. Often men take advantage of prostitution, so we need to engage men in knowing that those women are not there voluntarily to do that work. They have been coerced, kidnapped, brainwashed. And so I invite you to read on the United States Justice.gov website on how the government spent its money to promote awareness, educate the public, and especially educate men on crimes against women, because they are central to alleviating those crimes. And here is one nonprofit organization, Men Stopping Violence, and you could find them at menstoppingviolence.org. And the International Trafficking Institute partners with this wonderful organization. And that's a lesson for all of us to learn. When NGOs and nonprofit organizations partner with each other, they double their resources and they double their audience, and they educate more people, just like we're doing here in this global conference. We are uniting panelists from all over the world to educate on this very, very challenging topic, and topic in need of education. So, for example, they have a training series, What Men Can Do to Stop Sexual Exploitation, a conversation for men. So I do invite you to visit their website as well. And this particular organization, Truckers Against Trafficking, is one that I particularly want the world to know about. Trafficking means just that. We need to transport these victims somehow. So transportation is central in allowing traffickers to create these slaves, to keep these slaves working, and to earn money from these slaves. So Truckers Against Trafficking, through their website, through this wonderful video, which I would like to show you, has trained close to 100,000 truckers, people who drive trucks for their employment, and to identify and intervene. And because of this website and organization, close to 2,500 calls to the National Human Trafficking Hotline have been made, and over 1,000 victims have been identified and perhaps returned to their families. So the Truckers Against Trafficking is doing very good work. I'll give you a sample. The only thing, it's hard for me to get back to the PowerPoint. Okay, so this is their website, and this is just a sample of their video. This is a trafficking victim. She tells her story, how she and her friend had purchased an ice cream and were walking home, and they were kidnapped and put in the back of a truck.
My son and I were driving through Oklahoma City, had the radio on, and the guy comes on the radio, "Hey, anybody want any underage girls?"
One of the things that we saw that disturbed us quite a bit was seeing a van pull up with a woman driving, 5 or 6 girls that got out. It looked like they ranged anywhere from 15, 16, maybe 18 years old. But
she was totally in tears. She was freaking out. I guess they had said the same thing to her. And she was my best friend, you know, and I didn't want nothing happened to her, you know, and they already said from the beginning that if I tried anything, if I did anything stupid, then she would be the one that would pay for it.
So let me explain. Rather than show you more of the video, you can view it yourselves. This young lady was one of the two friends that was kidnapped. And the trick that the trafficker used was to threaten each of the friends that if they escaped, the other friend would be harmed. So that's one of the psychological ploys that traffickers use. So America's highways, the highways around the world, are modern day slave routes. So any form of transportation, we need to educate those transportation workers on the signs of trafficking. And there is a very insightful TED.com talk that is given by one of these truck drivers who now it is his life mission to end trafficking. So I urge you to also view that TED Talk and the video at truckersagainsttrafficking.org. The U.S. National Human Trafficking Hotline, which is operated by the Polaris Project, has a toll-free number, has the ability to text, and have live chats. Whether you are a victim of trafficking, whether you see the signs of trafficking and want to help a victim, please do take advantage of this resource. And they go on to explain where labor trafficking is found. And we did hear from our astute panelist, domestic work, small businesses, large farms, and factories. Malini?
Yes.
So I would like to introduce Malini Shah, Director, Center for the Women of New York.
Yeah, thank you, Victoria. So here we see the Polaris project wheel, and then we go on to why trafficking exists. Human trafficking is a market-driven criminal industry fluid by a demand for cheap labor, services, and for commercial sex. They have low risk of being caught and high profit margin. During times like COVID, hurricane, and earthquakes, they take full advantage of this. Left unchecked, human trafficking will continue to flourish. Community efforts can help to reduce the demand.
Oh.
Federal anti...
Let's look, Malini, let's look at slavery.
Slavery, yes. So we can look at the slavery if we take, which is very interesting with this link, is that you can actually go and take a survey on the slavery footprint survey, which we found very interesting, myself and Victoria, where communities can really help to reduce sex trafficking.
Well, and also the slavery footprint would also be on fair trade products that we don't buy products that were made from slaves.
Yeah. I don't
So
know
it's
if
a
we
very
can
interactive website.
Yes. We're not able to open the link, so I will continue. Maybe later we can, everyone can have a look at the link. It's very, very interesting.
I was able to open it, Molly.
Okay, sure. Okay.
Okay, continue.
Yeah. Federal anti-trafficking efforts. In 2013, the Federal Strategic Action Plan on Services for Victims of Human Trafficking in the United States was developed to increase the coordination, collaboration, and of federal agencies in combating human trafficking. The plan ensures the victims of trafficking had access to services through building capacity. And here's another example and another very good Department of Homeland Security. Here are some more resources that one can actually go through. And you can always look at them later. We go on to antislavery.org. we found that here is another definition of anti-slavery in the United Kingdom, antislavery.org in London. The source of human trafficking on chain. I strongly suggest that you view this video because some of the facts are in the video. Human trafficking is the third largest criminal industry, trailing the drug and weapons industry. It is a true global threat. In 2018, the Department of State estimated 11,096 prosecuted in the world compared to the 25 million people held in forced labor and forced prostitution around the world. Only 450 prostitutions from trafficked labor in the world. Traffickers enjoy almost complete impunity. On chain, the source of human trafficking. More facts from the video are in this, where 3 survivors tell us their story. And this has the same link as the one before that one can watch later. And I'll turn you over to Victoria back again.
Thank you, Malini. So we highly recommend that you view, it's only 26 minutes, The Scourge of Human Trafficking. So I would like to make you aware of this wonderful, wonderful NGO, ecpat.org. Now, the original name was Ending Child Pornography, but they steer away from the word pornography because they feel that it implies that these children want to earn a living by being exploited. So they steer away from that, the use of that word, but they do want to focus on exploitation of children. And what they do, they educate children in schools about trafficking so that they won't be tricked. They also educate children on the signs of perhaps what a classmate is exhibiting. Perhaps they can bring forth other trafficked victims that are hidden. It's hard. And they have all the signs on their website. For example, trafficked children don't make eye contact. And of course, they can be show signs of physical abuse. So I urge you to visit ecpat.org for the international website. They have locations throughout the world, and to visit ecpatusa.org for programs in our schools, if you'd like to bring programs into your schools in the US. Yeah, for some reason, I can't get to the safety tips.
A couple of more minutes, right?
Say that again?
A couple of more minutes, how long?
Yeah, 1 more minute, yeah.
All right.
So I won't go to the website, we're running out of time, but I do urge you to visit the online safety tips. They are wonderful. And please know that the hospitals in our countries are central to helping trafficking victims. And this particular hospital association has wonderful videos to view, to educate yourselves and to educate medical professionals. And here in Long Island, outside of Queens, outside of New York City, we have a medical professional who has taken on trafficking and has trained many medical professionals on identifying the victims that come through hospital doors. And please view these TED Talks on trafficking. They are insightful and are really comprehensive. And do visit cwny.org if you would like to know about our programs and how we help women. So do visit us at cwny.org and do volunteer with us. Our PowerPoint will be available at cwny.org, past events, in a few days. Thank you so much.
Thank you.
Thank you. Thank you so much, President Victoria Pelotti, for your wonderful presentation. And I believe we all will gain knowledge out of it and and help in stop trafficking globally. Thanks again.
Thank you.
Now, I would like to invite human trafficking, champion of human trafficking, and the winner of CNN Award of 2010, Honorable Anuradha Koirala. Unmute, please, unmute. Yeah, go ahead.
Namaste and thank you so much, Somnathji, and of course the GPK Foundation Chairperson, Honorable Sujata Koirala, for giving me this opportunity to say a few words of what we are doing in Nepal and across the border. And I would also like to say thank you to Victoria for doing a presentation, which was really very good. I'm not a person to evaluate, but I liked your presentation, Victoria. Thank you so much, Victoria, and both the presenters. Now let me start what we are doing. We at Mighty Nepal, I started in 1993. Since 1993, I've been working for human trafficking and sexual exploitation of children and women. And basically, we have shelter, we have hospices, 2 hospices for HIV/AIDS, and MDR, that's multiple drug resistant tuberculosis. And also, we have prevention homes in 2 places at present. And then we have from eastern part of Nepal to the western part of Nepal. The 2 borders between India and Nepal is open for all your information. Yeah, it's open. So we thought that we have to have someone at the border. We know there is a police, there is customs, there is immigration, but we still thought that they will give priority to their work assigned for. So we have started our own homes there, small homes. It's like a checking point. So, and the people who are working at the transit homes are transit points are girls who have been trafficked themselves. So I'm very sorry if I've offended anybody, but they are the best people to. I want to start from the border and then go back how I started Mighty Nepal. So they are the best people to check, because they have gone through this and they know who they can identify immediately who are being taken, who are being lured to trafficking. So this is why we have kept our girls there. So that means they are trafficked, they've come back, and then we have given them employment. Yeah. So that is one of the things which we are doing, and I feel that's very good, I think. And another thing, Mighty Nepal stresses on prevention. We stress on prevention. Prevention, like what do we do? What are the causes? For us, everybody in the world, everybody internationally, they say it's poverty. It's not poverty. It's not poverty. It is discrimination, gender discrimination, no education facilities, then no opportunity, job opportunities, open border, and of course, lastly, there is poverty. So we are working on all these issues, these 5 issues, and we are trying to educate girls. And now, since we are also lobbying with the government to focus on study, education of girls in the villages. Every time they say the government, Nepal, they say education is free. Not at all. Not at all. Education is not free. Even in a government school, you have to pay little, but you have to pay money. So again, now let me go back to gender discrimination. There are 5 children in the house. If 3 are boys and 2 are girls, fathers would and the parents would rather send the boys to school than the girls, because they think the girls will get married and go to someone else's house. Why should we educate? That is the general public's thinking, from where the children are being trafficked. Yeah. So we are forcing, we have said, we have lobbied with the government and said free education, compulsory education, and finable education. We have said that. So what does finable mean? If the parents do not send the child to school, girl child to school, they will be fined 1 rupee per day. If there is one girl or two girls in the family, per day they have to pay 2 rupees. So 60 rupees a day, 60 rupees a month would be a high cost for a father or a mother, for the parents. So they would rather send the children to school. So this is what we are doing in the villages. We are finding the people who are not sending the girls to school. Then this includes gender discrimination and compulsory education also. And then the third thing which we are doing is we are saying it should be free. Now to make the school free or the fees free is on the government side. They say it's free, but it is not free, because at the end of the month or at the end of the year, they have to pay annual fees, annual this fees, annual that fees. So it costs a lot of money. And as it is in the villages, people are not that very rich who could pay all this annual fees. So that is the government. We are still lobbying with them. So this is what we are doing with them. And of course, uh, this and then no job opportunities. There is no job opportunities. That is why many girls are going overseas. Yeah. They are migrant workers. They go to different countries, especially to the Middle East, to work. And now we also find that girls are even being taken to places like, where there is, the people have been migrant to European countries, but our girls are being taken there. Afghanistan, Iraq, Iran, all these places. Why? Because we have rescued them. We have brought them back. And then when we ask them, what do you do in Iraq? What do you do in Iran? What do you do in Lebanon? What do you do in Syria? They say, we work inside a camp for the army. And then what work do you do? We clean the house, and when they come for day off, then they exploit us. So this is also for me trafficking. I don't know how others take it, but this is also for us, it is trafficking. So I've been lobbying from the first day. I've been lobbying with the government when they started thinking of sending migrant workers to the Middle East. I said, this is wrong. If you want to send them through the right route, have a direct connection or a what is understanding of memorandum of both the countries, how they treat the girls. So they have not been doing it, but then they go via India. Now before it was all right. They used to go uh, from India. They are taken to India. Let me talk to all of you how about, not about cross border. I will come to cross border. I want to talk to you about overseas, which we call, very nicely people say it is, what is it, migration, which I don't think it is good. Yeah. And it has proved. So I have already given you Syria's and Lebanon's and Afghanistan's uh, detail. So in the same way, girls are going. First, they started going to the Middle East, and they are still going to the Middle East, and via India. If there is an airport in our country, why doesn't the government send them through Nepal, having a bilateral talk with the country of receiving? Yeah, but they send them. Uh, they give it to the manpower agency. Manpower agency takes them through India. But now it is more disaster. More disaster. The girls are being taken from here to India up to Delhi, and from Delhi they keep them there for 5 6 months, and in one room, and then slowly they took them. First we rescued 90 girls from Sri Lanka. Now,
Wow.
if you have a map in your eyes of the world, you can think where Nepal is, where Sri Lanka is, where the Middle East is. So they take them down to Sri Lanka and from Sri Lanka back to the Middle East. So I was really not very happy about it. So we rescued from Sri Lanka 90 girls, yeah, and then we brought them back. And in the same way, many girls are now being taken to the eastern part of India, and then from there they have been taken to the Middle East, yeah. But crossing from Indian eastern part border to Burma, and then from Burma to the Middle East. So that is also trafficking, I think. If it was migration, they would have gone the right route. I travel all the way from here to south to India, and then eastern India, and then again south to Burma, and then been trafficked. So these is migration. So recently, during this pandemic, when we were in lockdown, the girls had been stuck in the eastern part of India. Nepali girls had been stuck. 60 Nepali girls had been stuck in eastern India for 7 months. We were lobbying with the government, and during lockdown, they were brought back. Yeah, and then we brought them back with the help of the Ministry of Women and Social Welfare. So this is why I call migration is also trafficking. And people thought Anuradha was getting little cuckoo because she is saying migration is trafficking. So this is also trafficking for me. Now let me go back to trafficking. Trafficking in our country was not now. It has been since many years. Yeah, it has happened. It has happened, especially it is very much in districts, 7 districts, and of course, certain ethnic castes. Yeah, but that was only cross border. Cross border means to India. Yeah, in India there are big brothels in Mumbai, Delhi. Delhi came up very late, but Mumbai is the oldest one, and then Calcutta, all these places. But now even cross border, very near, it's coming nearer and nearer. So they have red light areas, and then our girls are being taken there. So that is how trafficking is happening. And you can, it hurts me, and then I think it hurts all the women in the world who cares about children. Children as young as 6 years are taken and then given those hormone injection to make them big. Yeah, and then when they come back, they are already 14 years old, and they are fully sick with HIV, multiple tuberculosis, MDR, and all this sickness, and then little bit mentally disturbed. So I think we really have to, all of us, all the presenters who are here today, have to join hands, and only we can make the differences. By saying we are doing this, we are doing that, does not help me. You have to work. All of us have to work. Otherwise, we cannot do anything. We will talk today, and tomorrow we forget each other. We have to stay in contact and think about something very concrete, how we can save our children. Yeah. So 6 years child being given hormone injection and making 14 years, you can imagine what it is. Yeah. So this is also one of the concerns, cross border, which is the most important one in our country, cross border trafficking. So for me, actually, with all my staff and everybody, we've been doing this for last 30 years, and we are constantly doing. And we have, as I told you, we have transit homes, we have prevention homes, we have hospices. We have 2 hospices in the country, and one in the eastern part and one here in Kathmandu. So this is what we are doing. And then, as I was also thinking, internal trafficking also. Yeah, my friends used to tell me, Anuradha, please, I think there is internal trafficking. I I said, yes, I think. It's not only I think, I have talked about it. Yeah, because now it's been about, say, about 10 years, gave permission to open cabin restaurant, dance restaurants, and ghazals and geese and whatever it is. Yeah. But small children were brought from the villages, and they were working in the this cabin and dance restaurants and entertainment sectors. And then there they were, they had to please that's what the children tell me when we rescue. Tell me they have to please the customer, and the more they make the bill, the more they get money paid, but they are not paid. So I have also talked about this internal trafficking and the children being exploited in these kind of places. So we have rescued them. We have rescued many of them, and many of the children are still with us, and they're going to school, they're going to colleges and all that. And I'm happy about it. And I do not know, because the honorable chairperson of this organization, GPK Foundation, to the power, and she does something about it. Yeah, about this entertainment sector. Then I talk to you about overseas. I talk to you about cross border. The biggest problem for us now is not only cross border, it is also overseas and the internal ones. The cross border ones is very, very difficult because it has been established for a very long time. And then the traffickers also are very well known. Every day, the traffickers are not someone who are from outside, they are from inside, in the village, the community. So they know. They do not go and say, I will take your child and, make her a prostitute. They never say that, or sell her. They go and say, oh, again, I'm coming back to the gender disparity. They go and say, oh, your girl is getting big. She needs money to get married. There is a big job in the city. She will do some work there. She will earn some money. She will come back after 1 year, and then there will be money, and then you can give her, it'll be easy for you to give her to marriage. This is how they say. Only, do you think only girls need money to get married? Even men need money, I think. Both the, men and women, they need money to get married. Yeah. So it's not only the girls. And then they say dowry system is over. Dowry system still exists. Otherwise, why do they say that you need money to get your daughter get married? So this is one of the things. And then the parents say, let me think. And they think, and then after that, they send them saying, okay, come back after 1 year. Okay. But then she never comes back. She never comes back. If if some organization like Mighty Nepal, basically it's always Mighty Nepal who rescues and repatriates girls from India to Nepal, from overseas to Nepal. So this is what is the situation in Nepal of cross-border trafficking. I have already told you about overseas and internal trafficking also. So I feel that just now Victoria was talking about how to aware people. Yeah, we have done awareness in the villages every till now. Since the establishment, we are doing the awareness campaigns in the villages, not only with one person. Not only Mighty Nepal is going, not only I am going, or my chairperson is going. We are taking university children, we are taking police, we are taking lawyers, we are taking journalists, and making a group and going from village to village. In one village, we stay for 3-4 days. During the day, we do not do. We do postering and pamphleting. And at night, we tell them to gather in a school, and then we start giving message. Police gives them, telling them about what will happen if a trafficker is caught. Then the lawyers tell them about the law, because our law is very, 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 very good. It is 20 years for traffickers, but it has not happened so far. 20 years, very few. And then the journalists tell them about how they will expose them. So this is, and then the ourselves, we activists, we talk, and the college students act like girls who have come back from India or from overseas, and they tell them the horrifying stories we have told them, and they tell it to the people. So it is that is how we do awareness in the villages. And then also Victoria talked about awareness to the truck drivers. We've been doing this for last 18 years. We are talking to the truck drivers, we are talking to every vehicle, because our girls are at the border at every cross points. So they are giving pamphlets and they're stopping the truck drivers, talking to them. And we also, we talk to the bus owners, bus transport owners, and then we do workshops for drivers and the cleaners. So we also aware them. So this is what we are doing. And then so far we have rescued 45,000 girls from all over the world, especially from India and from the Middle East. Then about we have prosecuted 1600 men and women. And now the longest one we have prosecuted was for 18 years. Yeah. So they're still there, but sometimes there are when prosecute these kind of person also. One person whom we prosecuted, so I supported him to study in the jail. And now, after 12 years, when he came out, he has become a PhD doctor. Yeah, that is a successful story. But I thought he would come and help me to fight against this crime, because I am not an expert. None of us who are speaking today are expert. He is an expert because he knows how to lure a girl, which are the routes, how to go and bargain, where to go and sell her, how much money you get. He knows the routes and everything. So I thought he would come and help me, but he said, "No, ma'am, I will not do this. I will do something to improve the jail system. The jail is very, very bad. So I will do something in the jail, and I will open an NGO for jail." So he's doing that. So I think, we reformed one person who came into the right way, and I'm very happy about it also, because as I told you, we have put 1600, but at least one came out very nicely. So he is there. So what are the solution? Well, how can we do it? How can we do it? Yeah. Victoria was also talking about education to men. That is the most important thing, I think, Victoria. And we are also saying, and I have been doing it since many long time ago, saying that real men don't buy women. Yeah. So this is what we have to say also, I think. And we have to educate men. I have also said there is gender discrimination, which is said by Victoria. And what are the forms of trafficking? It is not only for sexual exploitation, commercial sexual exploitation. It's for labor, I have spoken about. It's for surrogacy. It's for organ trade, marriage. These are the ways of trafficking of women in different countries. Huh? Huh? Okay. And then lastly, in our country, we are working uh, very hard. At present, when do the girls are most vulnerable? It's not only during the 4 5 things I've said, the causes, but we are vulnerable even in disasters. When there was an earthquake, there was lots of trafficking. Small children were trafficked, many girls and things, many girls and children. And then now, at this pandemic, there is lockdown, there is prohibition for people to walk about, but still, but the trucks for food and vegetables are allowed to go on the street. So the traffickers are taking children in these kind of trucks and going out of the country. So you can imagine, we are vulnerable even on this kind of crisis. The world is going through such big crisis, but we are still very vulnerable. The So I think basically, all of you know that this is a shame to humanity. I think all of us have to join hands and this heinous crime and save the world and save our children from being trafficked. Yeah. And then I would request all of you to be, I think today we have to thank GP Koirala Foundation for bringing us all together from all your sides, from all of you, what all of us can do, because I have asked you to join hands. Then only we can fight. We cannot always complain and say it's a big issue. We are trying our best. We are trying our best. But what we need is to join hands and work together. Really, even if we are apart. Look, see, this is so nice, Ira, that you can see me, I can see you in this, and we are talking to each other. So we can talk to each other and solve this problem one day. We cannot eradicate it. We can definitely minimize it, and then, make our children safe. This is one thing. And the other thing which I would like to say is also, of course, we all of us have to stress on, it's not only in our country. Don't think that everywhere it's in the world they say, oh, woman or man, gender, there is gender equality. They say, where is gender equality? I don't know where there is gender equality. Yeah. When your house, my house, anybody's house, yeah, anybody's house, we think boys are more important than the girls. Everywhere. Even if you go to politics, if you see the ratio in the politics, you'll see men are in a higher post than the girls, women. So I think we have to, all of us have to work on the equality of women. There should be no gender discrimination in our house. And then I think all the eastern and of course also the western country are listening. When there is, this is very important, very silly to listen to, but very important. When there is shortage of anything, edible things, or anything, or at this pandemic also, when you don't get any food, where there is lockdown, you cannot buy anything, you say, today my son cannot get a cup of good milk. Oh, my son cannot get a chocolate. What about me, girl? Why don't you think about me not having good things to eat or good things to wear? So, gender, first we have to see about gender. Then only we can talk about other things, I think. And lastly, I would like to say thank you to all of you. And I would also like to be in touch with all of you. And hopefully, we will remain together. And as I've said, two things, I think. Real man, don't buy woman. That is one, which Victoria said, men has to be educated. And the other thing is we have to join hands and fight against this crime, which is most dangerous, because there are three dangerous crimes in the world: arms, drugs, and human trafficking. So we are all fighting for human trafficking. So let's join hands and make this world a safe place for all our daughters. Thank you so much, and I would like to thank GPK Foundation and Somji and Honorable Sujata ji for giving me this opportunity to share my opinions. And we have the largest home in Nepal. I think in this, even in India, Nepal, and the Southeast Asia, we have the largest home. At this present moment, we have 200, in this also 215 girls with us. And in the hospice, we have 48 children who are terminally ill, but they look very nice now. So anytime you can visit us, anytime you can come with us. Thank you so much. And thank you for giving me this forum. And thank you everybody for listening to me. Thank you. Namaste.
Thank you so much, Honorable Anuradha Koirala, the champion of human trafficking and leader in the human rights issues. Like she said, let us all unite, as unity is strength. United, we overcome the issues, especially human trafficking. Again, thanks for your experience, knowledges you share in this panel. Next, without any delay, I would like to invite the emerging women leaders from our community, and she just the nominee of Democrat primary from Democrat elect nominee for Assembly member in New York State, District 34, and she has been working for the communities for so long, and she will be talking on women empowerment and leadership. Please welcome Jessica Gonzalez Rosas.
Thank you, Samnath, and thank you to the GP Corella Foundation for your important work and for this amazing conversation. It's wonderful to meet the chairwoman and all these distinguished leaders and advocates. So thanks so much for having me. I first wanted to say how proud I am to now be the nominee for the 34th Assembly District. Just to paint a picture of what the community looks like, it is one of the most diverse communities in the world. We are a community that is nearly 60% Latino and from all sorts of countries, Ecuador, Peru, Colombia, Dominican Republic, and we're 27% Asian. And the population, the Asian population includes a large Nepalese population. It includes a large Filipino population, a large South Asian, Bangladeshi, Pakistani, Indian. It is incredibly diverse, and there's over 200 languages spoken just in our district. So I am incredibly humbled to be able to represent the district in the future. I have one more election in November, have a general election, but as soon as we get through that, I feel very good about getting over the finish line and being able to officially represent this community. So a couple of things I wanted to share is about the work that brings me to this advocacy. I was a leader of a nonprofit organization called the National Latina Institute for Reproductive Justice. And at that organization, we worked to build power with Latinas, their families and communities, to be able to determine if, when, and how to create a family and be able to raise that family with dignity. So my expertise is not around human trafficking, but it is around intersectional issues that impact women's empowerment and leadership and autonomy, which is very, very important. Through that role at the National Latina Institute, I got to work very, very closely with women of color across the spectrum. I always say my sister in the work is an organization called the National Asian American Women's Forum. And then we also work very closely with the Black Women's Reproductive Justice Organization. And we would make sure that the voices of women of color were very central in the advocacy around autonomy, dignity, healthcare, and power. So again, I think we have to look at these issues very intersectional. Some things that are important to note is that women in terms of political engagement, and we see it here, right, in this panel, how many amazing dynamic women did we just hear from? And in terms of the leadership of the foundation and many of the organizations around the city and around the country and around the globe are women. And women are often at the forefront of fighting for their community, for their family. Issues are very personal, right? I always say the political is personal. So when something happens in your community, right, it impacts you and your own family and your own life. And it's often women who are taking the mantle to fight for justice, for equity, for dignity for our communities. So that's the work I've been doing for many, many years. And I think the distinction that's important to note is that as an advocate and as a leader who comes to eventually representing the district, I think about leadership in a few ways. It's not just about passing laws that impact our community, which is very, very, very important. It's really critical that we pass laws that impact our community. But it's equally as important to make sure that the women in our community have the ability to access those laws, right? So I used to fight, well, I continue to fight for reproductive health rights and justice. The ability for a woman to determine to keep a pregnancy or not is on the books. It's legal, right? But a person who their immigration status has prevented them from getting healthcare that they need, or the contraception that they need, or maternity care that they need. All those things prevent them from accessing those rights, right? So we have to think about things in a way that's intersectional. And intersectionality is the framework of my organizing. It means that while there might be laws on the books that essentially we're supposed to be able to benefit from, there's many conditions that impact a woman's life, a family's life, a trans person's life, an immigrant person's life, a person of color's life, right? That prevent them from accessing those laws. So, in this moment where, we're talking here in the United States about, Black Lives Matter, right? And we have to think about the impact on Black women. And for example, Black women die while giving birth at astronomical rates higher than white women, rates higher than other women of color. And it's not because their bodies are different, it's because the health system they faced many forms of discrimination in the health system, and they're often treated with less dignity and care than other women, right? So we have to look at these issues that impact the disparities, both the health disparities, the social disparities, and often the prevention from being part of leadership. So it's really important to look at this very intersectional and understand that we have to dismantle structures, right? Many structures here in the United States are very racist, very xenophobic, right? Like very anti-immigrant, very patriarchal, right? So oftentimes, men are seen as natural leaders. But what we know from community organizing, and again, I'm just so impressed with this panel because you're seeing it right here, is that women are often the backbones of their families and of their communities. So it's really important to make sure that we're lifting up our women leaders, right? And acknowledging and dismantling the systems of power that we need to address in order to ensure that we all have real, true equality. In the United States, women make 70 cents per dollar a white man makes. However, those numbers are different across the board based on your race and ethnicity. Asian women make about 80 cents per dollar a white man makes. But if you break down the population, it becomes very different when it's Nepalese women, when it's Filipino women, when it's women from Hmong, right? It's very important to understand the disaggregating the data. And for the Asian American community, unfortunately, everyone's lumped into one, but not everyone's experiences are the same. So it's important to really unravel that data and really understand disparities that different communities are facing. Latinas make 54 cents per dollar a white man makes. Black women make about 64 cents a white man makes. So it's important to understand that we have to fight for equality, but really recognize the disproportionate impact that women of color from different parts of the world, immigrant communities, people who speak different languages are facing on top of the disparities that women in general face. So that's the work I've been doing for my whole life. And that's the work that I actually bring to both the campaign for the community, again, recognizing how incredibly diverse the community is. It was really wonderful that I met with Samna very early in my campaign, probably, oh God, like last fall, I believe. We sat down and I want to learn about the foundation and the work and what the needs are of the Nepalese community so I can be an effective advocate. And then thinking about what are the needs of the Nepalese women as well, and how I can be the best advocate. And that's really important to me. So I'm so humbled and honored to learn from many of you about this issue, but also recognize that our power is intertwined. And while we have to recognize the disparities, I think, as many of you have said already, it's about coming together and building power together so we can address all these disparities, we can dismantle these systems, and we can really re-envision a new world where our voices, our solutions, our leadership is honored and elevated. So I'll end there. And again, I want to thank you for having me, and I look forward to hearing the rest of the panel.
Thank you so much, Jessica Gonzalez Rojas, for your valuable inputs in this panel and sharing your experiences on the leadership fighting for the community, especially the community minority among the minorities, Nepali community, and she's very closely working with us, and I wish her good luck ahead.
Thank you.
You're welcome. Next, I would like to invite Dr. Anthony D. Andrews, who is also the transformational leader, adjunct, and associate professor. Please welcome Dr. Anthony D. Andrews, Jr. Please unmute. Please unmute your phone. All right, go ahead.
Thanks, Vanessa. I began to start talking before I unmuted. Thank you very much. I appreciate it. I appreciate my brother, you pulling this distinguished panel together. As you know, my doctorate is in executive leadership, so this is not my specialty. So I was interested in hearing some of the solutions that people may come up with in regard to trafficking in this pandemic. And unfortunately, I have to leave soon because I have a national town hall or virtual town hall that I'm a part of that I have to be, I have to on a Zoom for. But I did want to be able to at least kind of talk about something that maybe Jessica talked about and also talk about the fact that there are some obvious solutions, but the experts here on this panel, I'm sure will be able to give these solutions to us. So in the pandemic, obviously, first of all, human trafficking is very invisible anyway, right? Invisible crime. Even more so invisible during the pandemic when everybody is faced with a lockdown. Whether you're talking about sex trafficking, whether you're talking about children, little boys, babies, human organs, all of those things can be hidden even further during the pandemic. And I'm sure in the countries that have been represented by the people on this distinguished panel, including America, that's a huge issue. I'm particularly interested in, of course, the area where you are, Somnath, in the 34th Assembly District. You have a very diverse community. And I am told, from what I understand from law enforcement, that you have a big sex trafficking issue there in that community. The community is very diverse, a lot of immigrants in that community. And of course, Jessica talked about the healthcare disparities, which should be exacerbated even further by the fact that we have a pandemic and some may not be able to get out and receive the services. Elmhurst Hospital was overrun with patients. And I'm sure the trafficking criminal activity did not help matters, but only complicated matters for those people looking to get healthcare, especially in that community. So I'd like to hear from the panel. I'd like, for us to at least begin to talk about, and I'm sure there are more learned people on the subject than me on this panel that can talk about how we fight this issue of trafficking in a global pandemic, which makes it even more difficult for the police to find those people who need help and for those people who need help to get out to the police. And the police are focused on so many other things. As it is, trafficking has not been a big priority for the police departments, unfortunately. And of course, it's a huge criminal enterprise. It makes it even more difficult when they're focused on protest and focused on being essential workers during the pandemic. So I'm sure that there are a lot of people on this panel that can talk about some of the solutions. How do we combat trafficking during this pandemic? As an elected official, as an academic, those are things that I think people should be discussing, because I think that, again, this crime is only exacerbated by this pandemic. And I open that up to everybody, to the panelists here, for anyone to jump in and just, as I said, my doctorate is in leadership. It's although I do chair the hospital board at Queens Hospital, and I chair the Council of Community Advisory Boards for the Health and Hospital Corporation. So I understand about the healthcare disparities, and I understand what the pandemic has done. But in particular, this pandemic and how it impacts those people who are part of the trafficking enterprise. I think that's a critical discussion to have. And And I think we have the right people on this panel to discuss it.
Dr. Anthony, continue.
So I'm wondering, with all the panelists we have here, and we're talking about in particular in this country, and the issue that we have in this country, and of course, Queens being the epicenter of the pandemic, and we may get a second wave. What do we need to do to combat the crisis here in Queens? It's tough enough to combat this crisis in Queens without the pandemic. What can we do to get people to come forward? What can we do to get people the proper health care? What can we do to make sure that this virus is not transmitted from person to person because of the trafficking, because those people being trafficked are not getting the proper health care? I'd like to know if anyone has any answers in regard to this, or any suggestions even, if not solutions, to how we combat this, because we probably will be going through a second wave, which means, again, the pandemic becomes exacerbated by the people who are being exploited in trafficking.
I have one suggestion. We have this huge anti-smoking campaign. You've seen the advertisements, and why can't we have a similar campaign for trafficking? Spell it out, you know, what types of trafficking there are, and spell out what a victim might present as, right? We said they don't always make eye contact. Even though they're in the public, they may not come forward and ask for help. So I think ad campaigns on how the traffickers lure their victims, saying what the NGOs are out there that have the resources to help people educate themselves, reaching out to parents on educating themselves on how to keep their children safe. So I think an ad campaign would be a good start.
But I think in particular, if we do an ad campaign, because there have been ad campaigns talking about human trafficking, right? This is stuff that everybody on this panel understands.
I haven't seen the ad campaign like I've seen the no smoking campaign. No, I haven't seen such a big push.
So how do we make that a bigger push then? So how do we intersect
money?
That?
You have to put money into it.
How do you get money? How do you phrase that so that it can become a campaign that somebody undertakes? You have to get an agency. If the law enforcement is not doing it, perhaps it could be the hospital and healthcare agencies that talk about trafficking being a healthcare issue, right?
Yes, that would be very, very powerful.
Perhaps that's
hospital personnel speak about direct contact with victims. Yes, I think that would be powerful.
Possibly, because I think, again, if trafficking is a healthcare issue, and healthcare is a big issue, especially given the pandemic right now, maybe the idea is, as maybe we talk about intersectionality, maybe the idea is to get that to intersect with something that people are looking at right now and really, really concerned about. And healthcare is obviously right on the top of the list of things that people are concerned about in this country right now. So maybe there's a way to get people to understand that there's another epidemic in our country right now. And it intersects with this epidemic, and it makes things more difficult to address that epidemic, right?
Right. I agree.
I see Kasum.
Thank you, Dr. Anthony Andrews.
Kasum, you need to unmute yourself. We can't hear you.
You're welcome, Simmons.
Okay, so thank you for your ideas for the solution of this human trafficking, especially, like you said, health care worker and health hospitals would be a good source for the no smoking ads, you know. That would be a very helpful and a very good idea for the solution. Thank you. Now,
thank you, brother.
I think you got to leave for the town hall meeting.
I do, but I hope I got this kind of guided into an area where we can try to come up with some solutions before we go through this second wave of the pandemic, because the crisis that will only get worse with the second pandemic, obviously. But thank you all very much, and I hope that I get a chance to discuss this with you guys at another point in time. But I'm honored to be here with this distinguished group of panelists, and I'm sure that some solutions will come out of this. Thank you again, my brother.
Thank you very much, Dr. Anthony. You can even share your email in the chat box so that we can reach out to you directly in the email, okay? Thank you. Now, next, we are going to India now. I welcome Kusum Kaul Vyas, women rights activist from India. Please.
Samna, maybe
unmute.
Yes. Kusumji, please unmute.
Yeah.
Hello.
There we go.
Yes, go ahead.
Yes. Can you see my presentation?
Yes,
Yes.
yes.
I want to share a presentation. I think this is okay.
Yes.
Yes, thank you. I would first like to thank Anuradha Koirala ji for her presentation. I was really moved. I was pained by her pain, which she shared about her country. It is actually a concern for India also, because we are very much aware how human trafficking is taking place from Nepal and Bangladesh. We are really concerned about it. But people from Nepal, they come to India for work. And I'm very proud of Nepali Gurkhas who have been in Indian Army since centuries together. So very proud of them. And we have many Nepalis around us who work so sincerely, so hard, and we feel they are part of us because of their sincerity and hard work and being such good human beings. But when we hear the stories of human trafficking from Nepal, it always pains me. And today's presentation of Anuradha ji, it has really moved me. And I felt, oh my God, what I had heard so far, this is what somebody is presenting the real picture of the scenario. And I don't know if Anuradha ji is there. I want to tell her one thing from India's side and from my side, because I am working in this sector, that we should, Nepal government and Indian government, they should do something about it. They should talk it one to one. I think it, and they should find a solution to it. That how can both the governments do something, make an effort to do something about trafficking from Nepal to India, and as she said, from India to other countries. And there are thousands of NGOs in India who are working in this field. They, along with the Nepal NGOs, can work together. I think there should be a total effort from NGOs and government together. It is not, I think, when the situation is so alarming for Asian countries, we all should work together to at least bring down and make some effort, at least to start with, that we can do something together. She rightly said that we meet today, we discuss, we debate, we deliberate, but some action should take place. I think this is the way forward. I would now like to go ahead with my presentation. See, definition we have already done. Calamities, natural disasters, epidemics, and pandemics. It increases that already
members here have talked about it. But third is that there is a research that poverty in India has increased by 12 million in this pandemic. And because of that, we are into a problem of human trafficking in pandemic. The research has been done by Dr. Neha Nimble. She says increasing number of poor and resultant economic inequality is a proven precondition for trafficking. Human trafficking in India during COVID-19. As we all know, what happens? Recruitment, transportation, delivery, and someone receives them. We are all aware of it. How? Coercion, force, deception. Why? Sex slavery, labor slavery, forced marriages. Here I would talk about India. As Anuradha ji already talked, suppose in our household there is a boy and a girl, the boy is given more nutritious food than the girl. That is very rampant, common in Indian middle class or lower middle class families. Then girls are not sent to schools. She's already talked about it, but I would like to talk about India also. Same thing happens here also. The girl is supposed to take care of the younger siblings. That is a big problem in India because the parents go for work and they leave the younger children in care of the elder daughter. That is why she doesn't go to the school. And preference is given to the boys. They will go to school, they will learn something new, and they can be in a job, and he can be better placed. So this is a big problem in India. Then we have forced marriages of young girls. We have another problem in different states. Let me talk about Gujarat. Because of the skewed sex ratio, there are maybe 800 girls or 900 girls to 1,000 boys in a particular community. I don't want to name the community. So when there are less number of girls, the traffickers, they get girls from other states who are poor. Yes.
Malini, mute.
Okay. So they get girls from other states and they sell these girls for marriage to these skewed ratios, sex ratio of the community. They sell these girls and they take the money. And sometimes these girls, they cannot adjust. Suppose a girl from Jharkhand or Bihar is married in Gujarat. She is sold here to someone, but they get married, but she doesn't know the language. She is from a different, India has different states and all states have different languages. It is not common like in UK or USA where everybody speaks English. Here it is a different story. That girl from Jharkhand, from a tribal area who is sold into Gujarat, in Gujarat they speak Gujarati and there they speak their own tribal language. So this girl does not adjust here. And within a year or two, she is again resold to someone else in Tamil Nadu. So we have, these are different kinds of problems we have in India, in different, so this is a question of forced marriages, how they happen and how trafficking is happening in these places. This is the data of human trafficking cases reported. They are only reported cases, not the real scenario of trafficking in India. And only few go to the police to report. Extreme cases, when they cannot handle it, they come to the police or they go to some NGO or some government authority. You can see that Rajasthan and West Bengal is the highest which has, all of you can see. I don't want to read it. And so this is the situation in Gujarat, in India, which is before. This is the situation before COVID, and I'm sure that it has increased during COVID. This is the data. 8,000 cases of human trafficking, 23,000 victims rescued during the year, 182 foreigners, and this would be foreigners would mean girls or boys from Bangladesh, Nepal. And here I would like to add another thing. In Bangladesh, the situation worsened for girls because of the Rohingyas when they came to Bangladesh from Myanmar. So this is a serious situation in Bangladesh. And girls are being trafficked to India and to other Arabian countries because of the Rohingya crisis. And 9,034 were the below, under the age of 18. They were minors. 20 to 65 million people are affected by human trafficking in India for different reasons. India is a source, destination, and transit. As Anuradha ji has already said, India is a gold mine for traffickers. Organ trafficking, as we already know, domestic servitude. Women, men also, they migrate to the Arab world for the lure of money or better job opportunities or a better life. There, they face this problem that the owners, they take their passport, they don't give them money, they keep them as slaves. And the worst thing happened during pandemic. They wanted to come back, but they did not have the passports, nor did they have the money for the air ticket. So they are held up there in the Arab world, the different countries of the Arab world, as sexual slaves. Anuradha ji and others have already talked about how young boys and young girls are forced into prostitution. Here I would like to add how young boys from these countries of Asia are being used in the Arab world for the game of camels. They keep the young boys for the race of camels on the back of the camel, and the boy cries because he's afraid of the camel. And when the boy cries, the camel runs faster and faster. So this is a big problem for young boys who are being used for camel races, and they are being trafficked to different countries of the Arab world. Oh. I'm sure, like other countries, as we had talked last time, the situation during COVID, the meager income on which the people had to live on. Then we had another crisis, which was a migrant crisis. People from Uttar Pradesh or Bihar, they had a job down south or in Gujarat or in Rajasthan. But during the COVID, when they were supposed to stay at homes, they are in rented homes, so they didn't want to pay the rent. So they thought they will go back. But in going back, they had no transportation. So they were held on roads, walking, some were cycling, and some were trying to find, and some were traveling with families. So when these people were on the highways, the traffickers, they were trying to find out who would be the potential girls or some boys. So they had a tough time in this migrant crisis. Again, there was a problem of trafficking. We have another big problem, as we had talked about domestic violence last time, that women they face domestic violence, and when some women cannot bear it, they run away from their homes, and then they become the first to be lured into sex trafficking by these traffickers. Then in India, we have a problem that we suppress our girls. We tell them, stay at home, there is no need of going out. This will happen, that will happen. So the suppression is so much that sometimes the balloon bursts and this girl runs away from the family because she can no longer bear the suppression she is feeling at home. And when she is out of the home, she is vulnerable to all kinds of vultures outside. That is a big problem. During COVID, people could not pay rents of their houses, wherever they are living, 1 room, 2 rooms, or wherever. They could not pay rents. So that time they became vulnerable to sextortion because they could not pay the rents and there was no source of income. Then people went to money lenders to take some money either for food or rent or something else. So they became targets of sextortion at that time because of money lending. And especially in rural areas of India, illegal money lending is a big job for some, and women become targets of that. I think if some of you have seen Indian movies, you must have seen in Mother India. This problem has always been there. Roti kapda aur makan. This is a problem which we are facing even today, though these movies were made 50 years back. Then we have potential victims, which are traditionally disadvantaged, gender, which means females. Then in India, we have a problem of caste system, where certain castes, they are vulnerable to such situations because they may not have education, they may not have access to certain, they may not be aware what is happening, they are suppressed by the society, by the government, or the people around. Then there are certain religious groups which are also suppressed in the same way. Studies have found that majority of the victims are women, children belong to scheduled caste, other backward classes, tribal areas. Then we have another victims, which are single women, those who are taking care of their families. And in this COVID situation, it has become millions and millions of single women who have no access to income generation. They have fallen prey to traffickers. We have actually many solutions. I'm talking at India level, multidisciplinary interventions, innovative technology, and entrepreneurial thinking. We need to have awareness workshops about human trafficking in both rural and urban areas and among the vulnerable communities. We have been doing it, it has been going on, but still funding the non-profit organizations which work for bringing an end to human trafficking. We have seen in India in last 5 years, funding which used to come from outside the country, from USA, different organizations, different international organizations were funding different NGOs in India, which has been stopped. Due to some reasons, it has been stopped, which needs to be renewed again. And I think it is high time that India starts that again. International organizations need to be involved in poverty alleviation, and above all, 5-year plans to decrease poverty with the support of corporates and the government. I think without the support of corporates, big business houses in their CSR, corporate social responsibility, we have to make these corporates, big business houses responsible for the society so that they can work with NGOs and the government to make a difference in the society. I have actually a lot to say, but I think as Anuradha ji already said, that we have to make our parents aware, the community aware what is happening to our society. We have to educate our communities. I think, and Dr. Anthony was saying what were the suggestions for USA. I have been in my past, I was in USA for certain conferences. That time I realized that it is only by talking to the community leaders, because they know the ground situation, getting different community leaders together, you can find the solutions to the local problems. Please convey it to him.
I will, thank you.
Yes. And I think, and overall, because it is happening to all the countries in the world, and especially we are the worst sufferers, Asian countries, and
Especially South Asians.
Yes, especially South Asians. I think we need to work together. We need to have a larger picture and larger target in front of us. We need to work together.
Right.
Nepal can do nothing in isolation. India can do nothing in isolation. Neither Bangladesh, neither Myanmar. We have to do things together. I think let us start. Koirala Foundation can start, and our organization can help you. I can take you to the government here, and
Definitely,
we can do something
yes.
for the future. We should have a 5-year plan that where
Yes.
we are heading and what we should do and how can others help us.
Right.
And in the larger picture of the humanity, we can do something together. We have to make a bigger effort, a larger effort. We have to strive hard to make
Larger
this
effort, bigger efforts, and
Yes.
and on top of that, most effective way.
Yes,
Yeah,
yes.
not
We
only
have
talk,
to do,
talk, talk, and get down in the field and let our work affects
yes.
for the right issue that we're fighting for.
Yes, exactly. And I think we have to make a pointed effort that we will be working only for this subject.
Okay.
You know, then
All right.
only I think we can make a bigger impact.
Thank you.
That is how I feel about the whole thing. Thank you, Koirala Foundation, for inviting me. Thank you, Malini ji. Thank you, Somnath ji, and Madam Koirala. I'm thankful to all of you for being patient to my presentation. Thank you.
Thank you. Thank you so much, Kusum Kaul Vyasji, for your presentation. And I hope we're gonna gain a lot of knowledge and work together, as you said, unitedly with a plan, time plan, 2 years, 3 years, 4 years, 5 years. But those plans should be most effective plans that will work out to the positive results. Thanks again. Now I would like to acknowledge. Okay, 1 second. I'd like to acknowledge BP Adhikari ji, joining from Nepal. He is legal advisor of Inhured International and human rights activist. Please welcome BP Adhikari from Nepal. And then we have Dilip Pokhrel, Girija Prasad Koirala Foundation's coordinator from Adelaide, Australia. Please welcome him. And Kusumji, can you just take out your
Yeah.
presentation from the screen? Okay, thank you. So now, without any delay, I'd like to invite one of our panelists, Mike Singh, who will be talking about the human trafficking on his own country from Guyana. Mike Singh.
Namaste to you there in Nepal and India, and the gentleman in Australia. Good afternoon to you, or rather, I think it's morning now. And Ms. Victoria Pilotti, thank you so much for your very insightful, very informative presentation. And also I wish to acknowledge Sujata Ji, who sits there in Nepal. Namaste, buenas tardes, good evening to everyone. Mr. Somnath, first and foremost, I express my sincere thanks and appreciation to you for inviting me to be part of today's August panel. Let me begin by recognizing an important thing highlighted by Ms. Pilotti. When she mentioned Atlanta, I have a home in Atlanta and I have a home in Miami. I spent the last 3 years a lot in Atlanta, and I got to realize that Atlanta was truly the crossroad of the whole human sex trafficking business in the United States. I did not know that. And once I became aware of this, it was like a shock. Everywhere around the Atlanta airports, there are huge posters and signs that say, if you see something, say something. Human sex trafficking, human trafficking is not welcome here. And I think compared to many cities around the world, Atlanta is truly an exceptional model. But on the surface, you would not know that this city has become such a mecca, for lack of a better word, for human sex trafficking. Last year, we had this year was the Super Bowl in Miami. And Miami went to great extremes to educate people about the importance of being aware of human trafficking. And there is a link between this and big sports, believe it or not. The NFL is one of the biggest meccas for sex trafficking of young women in the United States. But let me take you beyond the borders of the United States to Latin America, and I will go back to Asia. We talk about the Middle East, about the camel, the little boys. I have read and I have heard horror stories of Filipino women who were sexually abused and stripped of their human dignity throughout the entire Middle East, the UAE, Qatar, Bahrain, Kuwait, Saudi Arabia. And because these are patriarchal societies, women have very little or no social protection. So I begin with the premise that human sex trafficking is a gross violation of human rights. And I acknowledge the immense work done by Hillary Clinton in highlighting this scourge when she was the US Secretary of State. When you had the partition of India into two parts, East Pakistan or Bangladesh and Pakistan itself, I think there was over 19 million people that were displaced over a few months' time. Unbelievable. You've heard, of course, you're aware of the Syrian tragedy, people trying to get from war-torn Syria to Europe via the sea, via land, and God bless the Italians. They've been the most humane in rescuing Syrians left floating in the middle of the Mediterranean. Now, last year, I was traveling in Africa 3 months in many countries: Ethiopia, Niger, Mali, Burkina Faso, Ghana, Togo, Nigeria, Morocco, Sierra Leone, Ivory Coast. And I can tell you, there wasn't a single moment I went through an airport I did not see officials from the United Nations International Office of Migration or the United Nations High Commission for Refugees. And I saw so many Africans being repatriated back to wherever they were smuggled from. I met a lady and her child from Nigeria in transit in Morocco, and she spoke English, and she was in the line going through the in-transit area just ahead of me. And I asked her a few questions, and she said, yes, sir, we paid human traffickers huge amounts of money, and they took us up to the Libyan border and left us in the desert. I met officials from the United Nations working in Niger. They come in every day with a list of names of persons they've rescued. I went right up to the border with Libya and Algeria as part of my professional work in the telecoms field. And I saw the shoes of people that were left in the Sahara. We don't know if they died. We don't know if they made it safely across the borders into Algeria or Libya. But many of these people are herded into warehouses in Tripoli, and there is a civil war outside. You would have seen it on Al Jazeera. Thousands of these people were rescued. So human trafficking is big business, and the world has to come together. But I bring you closer to home in Latin America. Did any of you know in the last 5 years, 3 million Venezuelans fled their country? 3 million Venezuelans went in every direction they can just to avoid starvation, human rights oppression, and you name it. Some Venezuelans, I understand, made it as far as Afghanistan and Iran. Now, that's a vast distance, but there are Venezuelans working in the oil sector in Iran. Countries around Venezuela, such as Brazil, became overrun with Venezuelans. And because there were a few crimes by a few bad eggs, the Brazilians turned against the Venezuelans and began to beat them mercilessly. These were Venezuelans who were living on the streets in the border cities of Venezuela and Brazil. Many Venezuelans made it to Argentina, Chile, Peru. I mean, we had a huge displacement, 3 million people over a space of 5 years. They sold everything, got on a bus, and headed in every direction. Colombia took in 1 million Venezuelans living today in Colombia. In the case of Guyana, which shares a border with Venezuela, we took in about 70,000 Venezuelans so far. Now, Guyana is about the size of the state of Idaho. We have about 750,000 people. We're not a wealthy nation, but we took in the Venezuelans. Despite we have a border problem, Guyana and Venezuela have a border case now in the World Court, where the Venezuelans are claiming 3/4 of our land. So here we have a border issue with a country, and its people are fleeing into our land. Most countries will draw up a fence and say, go back. Guyana did not do that because we looked at the human issue, that these were human beings like us, We allowed them in. We've given them the right to free healthcare, free education, and whatever skills they have, we're glad. But some of them are creating problems too. It's not easy. Trinidad and Tobago, on the other hand, has taken an approach that comes straight out of the playbook of Adolf Hitler. If you're Venezuelan and you make it over to Trinidad and Tobago, which is only 12 miles away by sea from Venezuela, they are going to catch you and lock you up. If you're lucky to get out, they make you register with your fingerprint, your retina scan, you name it. And the Trinidadian government has been taking this data and feeding it right back to the Maduro regime in Caracas. And that is a violation of the United Nations High Commission for Refugees agreement, the Geneva Agreement, which Trinidad signed. Guyana is not a signatory to the agreement or the 1967 protocol. Trinidad is, but yet we are doing the right thing, but not in Trinidad. In fact, numerous stories abound in the media, on social media, and in the newspapers, but instances where boatloads of Venezuelan women are taken from the beach once they land to brothels. These brothels are owned and operated by persons in law enforcement and in the government. You don't see the face of the government officials that are co-owners of these brothels, where the proceeds of the sexual exploitation of refugees flows into the pockets of corrupt government officials. As I speak to you today, Trinidad is actively, Trinidad and Tobago is deporting Venezuelan refugees back to Venezuela, where they face persecution. Sex trafficking does not take place in any society without the culpability and active involvement of highly placed officials in governments. Because many of these bars where these young girls are forced to perform, dances, engage in illicit activities, and what have you. You can report these things to numerous law enforcement agencies, and very little or nothing happens in many countries because it's big business. There is a link between illegal migration and the production of counterfeit goods. And I urge you to read a book by the former Venezuelan Trade Minister, Moses Naim, M-O-S-E-S, N-A-I-M. 10 years ago, I met Mr. Naim at a conference, and he talked about when you see a refugee in the street of Milan selling a very high-end bag, usually that's a counterfeit product. Now, what do we in Guyana do? A small country, barely 750,000 people. We're overwhelmed, we're overrun. And with the pandemic, I can tell you, the migrant population, the displaced persons, the refugees are truly the most vulnerable because they don't have access to a social safety net. They don't, more than likely do not speak English. Many of them are speaking Spanish. And if any help is given by the state, it will go first and foremost to its own nationals. So the role of NGOs in helping these people is their only lifeline. to depend solely on the United Nations High Commission for Refugees or the International Office of Migration is not enough. These agencies are overwhelmed, the resources are stretched thin, so there has to be a partnership between public and private sector. And I can tell you that just recently, I wrote a letter to the chairman of Reckitt Kaiser on behalf of my foundation, requesting things like Dettol soap and Lysol. And in 24 hours, I got a response. I salute Lakshman Narasimhan and the people at Reckitt Kaiser for their humanity. I know over 10 million bars of Dettol soap is being distributed across India. But India is not permitting the export of Dettol soap or Dettol products because India needs it for its own fight against COVID. There must be, as one individual said, tougher measures. I'm calling here not only for the jailing of officials, but we should put sexual trafficking, persons arrested, indicted, or convicted in the same category as war criminals. There must be an international tribunal like the International Criminal Court in The Hague to try persons, especially state officials, who are the authors and beneficiaries of human sex trafficking rings. I'm calling for countries who do not do what is expected of them to fight international sex trafficking to be shamed. They need to be published. They need to be boycotted. Because this is no different than what the Nazis did to the Jews. Organ harvesting, stripping people of their human dignity. Personally, I do not believe the consequences and the legal repercussions meted out to persons who operate global and national sex trafficking rings are no way as severe as the crimes that they commit. It requires international collaboration at all levels. There must be an international treaty or agreement that must be signed by all the member states of the United Nations, all the member states of the Commonwealth, of SAARC, of CARICOM, saying in a very clear manner that human sex trafficking is no different than drug trafficking. Because the consequences are minor compared to drug trafficking, these gundas, as you say in India, or criminals, know they can get away with it. But if you have tough laws, which includes being placed on the Interpol list, mandatory acquisition of the gains of sex trafficking, such as their wealth, their bank accounts, their properties, only then can we tackle this problem effectively. You must hit them in their pockets. I did not know that Nepal had such a huge problem with the trafficking of girls. Only the other night, I was going through the films on Netflix, and I saw this movie. I didn't watch it, but it's there that talked about a young girl from Nepal that was sexually trafficked into Europe. And before I think she was rescued. I'm going to watch that movie, and I just did some research. And I want to salute the lady from Mighty Nepal who won the award for highlighting this, and all of you for the work you're doing. But in closing, Somnachi, and to the other respected panelists and to Sujata ji, there has to be strong international legislation, mandatory criminal sentencing, mandatory acquisition of the proceeds of the owners and the authors and the operators of these international sex trafficking rings. Their visas should be canceled. The United Nations should treat them as outcasts. Countries who are actively hosting international sexual trafficking and human trafficking networks, if they fail to adhere to minimum standards, those countries should be boycotted. We should not buy their products. We should not trade with them. We should cut them out of the international financial system. There should be heavy embargoes placed upon them, placed upon their leaders, because unless you do this, you're not going to make any progress. We can talk from here till Taiki don't come, but unless you have strong legislation and imbued international consequences. In fact, I'm openly calling all of you to support the need for an international criminal tribunal to deal with the issues of international sex and trafficking of people. It's modern day slavery. It is unacceptable. And even worse, it is stripping a human being of their respect and dignity. And being a long time supporter of the virtues and the philosophy of Bapu Mahatma Gandhi, I do not believe any human being should be stripped of their dignity and self-respect. I thank you all, and I'm happy to answer any questions. Dhanyawad.
Thank you so much, Mike Singh ji, for your experience that you have in in the field of human trafficking. As you said, you travel a lot of countries and you share among us, and we fully hope that we can learn a lot and work together again to minimize this pandemic. I call it like in the pandemic period. So this is also a kind of pandemic. So we have to minimize this pandemic. We have to find out the vaccine, which might not cure 100%, but hopefully it can cure 90% of this pandemic of human trafficking. Thanks again. Now, I would like to invite to talk about this issue, human trafficking in Bangladesh. And she is also our panelist for today, and the president of Patigor. And she is Mahbuba A. Kabita. Please share your views on the issues of human trafficking in Bangladesh. Please unmute, yes.
Okay, thank you so much. I really appreciate GP Koirala Foundation for organizing such an important event and allowing me to talk about it. Honestly, recently I'm not working on human trafficking in particular, but my involvement with domestic violence is a huge contribution, I could say, and I could share my thoughts and ideas related to domestic violence issue, which has definitely connection with the human trafficking issues as a whole. And thank you so much, Somnathji, for organizing such an important event. Okay, so if I start talking about domestic violence issues now in New York City, I'm in New York right now, and going back to Bangladesh, the Bangladesh situation. I would like to bring last night Time Television report that it says the domestic violence issues raised from 5% to 16% in New York City in total. And just giving an example what is happening, because I'm receiving phone calls from different community and others, that just give an example that what is happening. During this COVID situation, people, they do not have job, they are staying at home and in a one-bedroom apartment. So it's crowded with the children and the families and together, and the man cannot make money. So they are insisting their spouse, the woman, to bring money from their parents. So when the woman decided not to talk about it, then the man pushed her out from the house. So when she was on the street, she called me and my other team member. That's why I came to know that what is happening. We managed. The other situation, it is in Bronx. Other situation happened in Parkchester, quite similar. They were talking, fighting within the family. That is a joint family. Again, it's a crowded one-bedroom apartment, and they were trying to get money from the woman, and the woman did not have money. So they were pushing her to collect money from her relatives here who can. Then finally, woman says that, okay, let me go. So when she left the house, both the husband and his mother locked the door. When she returned back, they did not open the door, and the woman was crying that where she will go in this situation, this COVID. Okay, another example. This COVID-19 is not for men, not for women, not for children, it's for everybody. When the man is infected in the house, if it is not reported to bring them to the hospital, the woman or the person have to take care of the man in the house, have to take care of the children of their house, no matter what the situation is. This is just a glimpse of what is happening during this COVID-19 situation in New York City, within the Bangladeshi community, when the crowded community, Astoria, Bronx, Parkchester, Fordham Street, and so on, and Queens in total. If I come back to Bangladesh situation, which has definitely a relation with this trafficking, but the Bangladesh situation, this is known to all that Bangladesh are facing so many problems, like the Rohingya issues, like the migration issues, and all these are connected to the violence of women as a whole, for the community and for the family. It's not only for the woman, it's for the children as well. The girl child, they are neglected. And so many panelists, they mentioned about the gender issues, gender discrimination. Definitely it is in Bangladesh as well, that the men are taking care as a lord, as a leader of the family, but the woman, they don't. The girl child, they are neglected for every perspective, in terms of food, in terms of education, in terms of shelter, for all perspectives. So when we talk about, this is all related to, this is the humanity issue. This is related to poverty. But it's not only poverty, not only we can say for one aspect. We have to think about the gender issues, as we mentioned in our last discussion over here, that we have to change the patriarchy, the patriarchal system, and it should start. We could think about going beyond the box. If we continue thinking within the box, we will keep doing the same thing, and the same thing will happen. We are working to empower women. That's wonderful. So women development is helping women to raise their voice, to get their education, to have their job. But still the patriarchy and the socialization system says there are very clear-cut division of labor. The man will make money and woman will do the household work. So when it is coming from that primitive society, then goes to the slavery society, then it follows to the feudalic society. Now we are in the open market society, nothing changed. What changed? Because of this woman empowerment and woman development issues and activities. So women, day by day, they are becoming more educated, they are coming out, they are having their jobs. So their professional life has been changed. But the attitude of society does not change. So the man is acting with women like when they were not working, when they did not have education. So the men still, they did not learn how to communicate, how to act, how to deal with a woman who is educated, have job, and it's contributing the resources to bring the family with the man. What was the man's role? So the woman is sharing the man's role, but man is not ready yet to share the domestic works, household works responsibility with woman. That's one very clear-cut issues, and it has a very significant connection with the human trafficking. So my suggestion as a solution, if we come up with a thought outside the box, that we could work with the reproductive health system, we could work with the pregnant woman, we could initiate, we could change the socialization system to raise the boy and the girl in a similar way, not giving the highest priority to the men when they were born and brought up, and to the less priority to the woman. And if we work together, definitely there are ways to resolve this problem. But woman empowerment alone cannot do. Thank you.
Thank you so much, Mehbooba Akhtar. She's also the president of Batikor. As we know, Batikor is like a house of lights, and she's trying to give lights to all the sufferers in our community. And we have been working closely and together for the betterment of our coming generations. Thanks again. Now, I would like to invite the legal advisor of Inhuret International, BP Adhikari, for his few minutes of the statement that he is connected to human trafficking, as he is also the human rights activist from Nepal.
Thank you very much, Somnath sir, and I would like to thank the entire team for giving me this opportunity. And today I'm not going to speak more about it, because Anuradha Koirala already said, and I agreed with her. My name is BP Adhikari, and I am working at Inhuret International as a legal advisor. Inhuret International is a frontliner human rights organization of Nepal, and it has a own component of the safer migration, and human trafficking is the major component of the organization. And after the earthquake, this organization has implemented many safer migration and the anti-human trafficking program in the community. So today, I think in the Nepal context, I think two things is a major thing to reduce the human trafficking. Number one, we should properly implement the rules and regulation. And number two, we provide educate and the equal education to the girls and women. If we do that, then we can reduce the human trafficking. So today, Sumna sir, I'm not going to tell more. So next time I will do. Thank you very much for giving this floor, because I'm enjoying to listen many participants, many panelists. So I'm very happy. Thank you very much.
Thank you, BP Adhikari-ji, the legal advisor, for your short and sweet remarks. Now we are at the end of this first session. Then there is few questions to be answered from our live viewers, from our audiences. As we all know, this 8th series of GPK Foundation America's Global Virtual Conference is going on, and it is on live on Facebook and different social media as well. So there are a few questions to be answered, and I have a couple of questions from the viewers. And before we end this first session, I would like to invite GPK Koirala Foundation coordinator from Adelaide, Australia. He's also an anthropologist, to present his thank you note. Dilip Kumar Pokhrel.
Hello, I would like to thank you all panelists
no
who
video,
actually
please. Switch on your video, please.
Sorry.
Yes.
Yes. So also who actually contributed their precious opinion regarding the human trafficking in this pandemic period and post-COVID-19 as well. I really thanks to all panelists and also the Somnath ji, who is actually working hard to actually doing a conference, virtual conference on the Zoom and also the live Facebook. And we have acknowledged those and knowledge, precious knowledge to understand how actually is happening all over the globe. So I'd just like to put some quotation marks from the panelists who actually talk about the gender relationship between the male and female. And I really like to quote that man has to involve in this process, because the capitalist patriarchal is the most vulnerable economic economic system, which is actually allows to do this sort of human trafficking activities from the other people. So we have to work together with the man who actually likes to be to be equal and emancipate with every human being. So as an anthropological point of view, I would like to actually acknowledge the Mary de Simone Beauvoir, who was actually writer of the second sex. So I really appreciate, and also in the end, I would like to again thank you to Somji to give me opportunity to give them, all of them, the thank you note on this precious global conference. So thank you again.
Thank you so much, coordinator of GPK Foundation Adelaide, Australia, and anthropologist, for your thank you note and giving some opinions as well. Thanks again. Now, as we go along, there is like 10 minutes session left for second session, which is also called QA session. And I begin with the QA sessions, asking the questions from one of our viewers to President of CWNY, Victoria Pilotti, she doesn't want to mention, so for her, whatever the reason, so I'm not telling her name. She says, your presentation impressed me a lot, to encourage me a lot in our community, teenager like me. What would you suggest us or teenagers all over the world as a concrete solutions to minimize this human trafficking issue globally?
Well, as a teenager who just educated yourself, you could research NGOs in your area and volunteer with them and spread the word. But also, teenagers are so good at using social media, at using the various video applications. Make your own little video with the research that you've done and what you've learned today, and spread the word that way. And maybe your video will go viral.
Thank you, President Victoria Pelosi. I hope she gets that. I believe she's watching us, she's listening again, still. Now, next question goes to Kusum Kaul Vyas from India. You said there is number of human trafficking as you go along your presentation in the different states. Why do you think Rajasthan and West Bengal had like more than 50 compared to other states, almost 70-80% higher? Why do you think so? Is higher than related to other states? Please unmute. Cannot hear you. Unmute, please. Kusum Kaul Vyasi, unmute your voice, your microphone. I cannot do it from my end. You can control from there. I cannot unmute from here like you did earlier. Okay, so whenever you are unmuted, just let me know. The next question goes to the Malini Saha. What is the total cases or total problems that you know or familiar in regard to human trafficking and in the Indian community in the US.
Can you repeat?
One of our viewers is asking, what is the total cases in terms of percentage or in terms of numbers of human trafficking cases, issues that you are fighting for in the US, in the Indian community?
Oh, well, from the Indian community in the US, I don't think we have the statistics based on that as yet, but it's something definitely I would look into to get the last statistics I saw. I don't want to report an incorrect number.
Right. Okay. Do you have any suggestions?
Well, I'm working along with Victoria at the Center of the Women, and we have been hosting roundtables addressing these issues also. And we're so happy to join this global forum. Somnathji and Kuryalaji and all of you speakers were so wonderful. And as Victoria rightfully said, I think coming up with the making a video and following, it's something that we all as a community have to come together and combat this because it's definitely an issue that shouldn't be continued, and coming up with the healthcare system, if they also get involved, as our last speaker said, and stopping trafficking and the transportation back and forth. I loved what was said on that also. So there are many issues. I think we're in our I think we should continue speaking of how we can all come together as a community and resolve it.
Thank you, Maliniji. Thank you. Okay, Kusum called Vyasi. Yes, you are unmuted now. Please go ahead with the answer.
Yes, the major reason for West Bengal is high population density and poverty. That is the major reason for West Bengal as well as in Rajasthan also. And besides, West Bengal has a border with Bangladesh. Migrants coming in from Bangladesh and settling there, and they are trafficked, and they are into sex, this business, prostitution. So that is why Bangladesh, and this West Bengal has missing children 20.64% in 2016. It rose dramatically, whereas overall Bangladesh has 44% of trafficking in whole of India. These are the major reasons for this. And Rajasthan being a very big state, and the business, the job avenues are not enough in the state of Rajasthan. And a big portion of Rajasthan is a desert region where there are not enough economic activities. So that is also a reason for Rajasthan being and education level in both these states is less. Literacy rate is less in both these states. So I think these are the reasons for high trafficking, and being both these are they have porous borders. Rajasthan has with Pakistan, and Bangladesh, West Bengal has with the Bangladesh, and Myanmar also going to others through other states.
Thank you so much, Kusum Vyasi, for your specific answer to that questions. And I have the final questions for today. Two again, going back to Victoria. So she thanked this foundation for this kind of very knowledgeable session that we learned a lot as part of his statement. And she's asking to Victoria, why don't you start teaching online on these issues like domestic violence and trafficking, human trafficking, at least how many days? At least 3-4 days a week, half an hour or 1 hour online classes would be very helpful and to get to know more about this. What is your take on that?
Well, I thank our viewer listener for volunteering me to provide a class several times a week. I will consider it. I will also consider having our organization make more readily available the videotaped sessions that are already on the internet and making sure that they are more visible to everyone. There is a wealth of information out there. We just need to spread the word on accessing it. But yes, I will take that into consideration. Thank you for that suggestion.
Thank you. So, okay, Kusumbiyaji. Unmute, please. Trying to say something. Can you unmute?
Yes. I thought initially if we could start doing something on social media, because today's younger population is, they are more hooked to online. Whatever they do shopping, or they're always looking into their mobiles. If we could initially start doing something on social media, maybe we reach youth through Facebook, WhatsApp, and different social media apps. And we could educate them and make them aware what is happening around the world in social, in this trafficking, human trafficking. We could educate them.
Yeah.
Why don't we start that?
That's a great thought in this digitalized world. Like we are joining here from the same technology all over the world, and we can see it.
And everybody's and mostly people are at home at present. Right. So I think we would have time also to, if we could do something like that, we could brainstorm about it next time and start something.
Right.
Yeah.
What do you say on this, Mike Singh?
Hello, can you repeat the question, please?
Someone asked President of CWNY, Victoria Pelotti, to continue doing this kind of online. She wants as a student for her online classes, at least 2-3 days a week. That would help a lot, like her, the teenagers to learn more about it, and we can even involve in fighting together. So what do you suggest for the online classes, online, like I say, online training, whatever, on this issue?
Coming from the technology background, I think today with the prevalence of hyper-converged, available networks, once a person has access to good broadband connectivity, you can learn anywhere at any time on any device. So one is no longer bound by the traditional restrictions or challenges of geography and time. I think it's great. Ms. Pelotti has so, readily availed of herself and has promised to look into making her knowledge and our organization and their collective knowledge available to the world. I support it. And I think, it's not only for the people here, but we have a global audience. We live in a truly global village. And so everyone today, this is the first time in the history, the whole world is so interconnected on some device, either the laptop, the PC, etc. And I think the question came from a younger audience.
Yes.
People have smartphones and they could do videos that could go viral. I think the power of social media in an era of COVID-19 is even more important. In India, we're seeing what Geo Networks has done, bringing connectivity across 16,000 towns and villages. So I think it's you can do this and you have it archived. She said she'll make it more readily available for viewers. You know, we ourselves at the Demerara Charitable Foundation will welcome collaborating with Ms. Pilotti and her team because we're all about collaboration and being connected. I hope that answers the question.
Thank you, Mike Singh. And finally, any suggestions on this by our Bhattigar President, Mehbooba Akhtar ji? Unmute your phone, please.
Is that what?
Yes.
Okay. So I just want to repeat that that suggestion. I made it before that we have to work together, as Anuradha ji says, definitely, and we have to bring things into action, not only just planning and talking. And the third thing is we have to think beyond the box, or outside the box. We have to think about. We have to change the socialization system to bring to make the upbringing issue equal to the men, boys and girls from early childhood to the next level of the young adulthood and same. And thank you so much for this wonderful event, and thank you for inviting me. It's my privilege to be here. Thank you so much.
Thank you. Thank you. So that ends the 8th series of global conference conducted by GP Koirala Foundation America. Yes, go ahead.
I want to wish everybody a happy Ganesh Chaturthi. Yes. And so that Lord Ganesha gives us courage and all kinds of support for our future and yours and whatever we want to do for the humans.
Yeah. Thank you.
Thank you.
And as Victoria Nas at the Center of the Women said, we must continue to educate everyone. And I love the fact that the men are also being involved. And I think this is also a very big thing to spread the word, educate. I think we will get the word out there and send flyers and whatever social media, as Kusumji also said, we can get this going. Mm-hmm.
Victoria, and especially the teenagers are demanding for online education as well.
Yes.
So think about it, like Victoria, she will consider it. So let's work together as a human, man, woman, all together to minimize these issues of human trafficking, domestic violence, and other related issues that community is facing during COVID-19 and after post-COVID-19. So we don't know what's going to happen in new world of post-COVID. So we have to work together no matter what, where we are from, what color are we, what race we belong to, what country we belong to. It doesn't care. Just we care about human needs and human deeds, and let's work together for the betterment of our future generation. Thanks again, everyone.
Victoria saying something.
Okay, Victoria, go ahead.
No, I agree with everything Samnath is saying. We will all work together, and we formed a community today all together. Yes. So we will keep in touch.
Yeah, we'll keep in touch, exactly. Yeah. And let us know what the foundation can do to promote any issues, to work together for the, like I said, for the betterment of global citizens. Yes. Thanks again, all the panelists who have given us your valuable time and valuable knowledge and valuable experiences that you share among us. And we hope we learn a lot. And it is not only we learn, but we must implement what we learned. That's the only one we care about. Let us implement to each and every community and fight against the inequality and against all violences in our global community. Thank you again, and we look forward working with you together. Stay safe and healthy.
Thank you. Thank you.
Good day and have a good night.
Thank you. Thank you.
Thank you.
Thank you.
Bye.
Bye-bye.
Bye.